Daily coronavirus cases in the state are still going down a little bit since passing 7,000 cases at the start of the month. A little less than 4,000 cases were reported today. That's below the 21-day average for the first time in weeks. But when we're looking at the data, the state usually sees the lowest number of new reported daily cases on Mondays. Keep in mind, it was a holiday weekend, too. Hospitalizations in Ohio are also lower than average, with 61 new patients admitted. The Delta variant has been driving that surge here in Ohio and all across the country.
It's not only it's not the only COVID-19 variant out there. You may have heard of the Alpha, or maybe the Lambda. How about the new one, Mu? Tonight, 5 on Your Side investigator Scott Knoll takes a closer look at the Mu variant and the potential impact here.
To understand what's going on with all these variants, doctors say you need to understand one thing. The primary purpose of a virus is to replicate, but it's not always a perfect process. Sometimes there can be slight variations or variants. One of those variants is what's been labeled the Mu variant. First detected in Colombia in January, it's now been found in 39 countries, including the U.S., and just last week was added to the World Health Organization's list of variants of interest after the WHO said it shows signs of resistance to vaccines.
We certainly are aware of the Mu variant. We're keeping a very close eye on it. It is really seen here, but it is not at all even close to being dominant.
In fact, the global initiative on sharing all influenza data, which tracks variants, shows just 27 cases of the Mu variant reported in Ohio. Dr. Amy Edwards, an infectious disease specialist with UH's Rainbow Babies and Children's Hospital, says there's still a lot of unknowns when it comes to Mu.
Central and South America doesn't have high enough vaccine rates for any kind of relevant clinical trial to detect whether the vaccine is still holding up against Mu.
Edwards says right now this latest variant isn't a major threat to the U.S., but adds that could easily and quickly change.
If Mu can outcompete Delta, then it could make what's turning out to be a bad outbreak even worse. If it turns out to be kind of the same as Delta, then it may not matter. That's still to be worked out.
The key, according to Edwards, is to get people vaccinated. She says if we could get between 70 and 80% of people getting the shots, we'd see a lot fewer of these mutations. In Cleveland, I'm 5 on Your Side investigator Scott Knoll.